I'm looking forward to seeing you all in today's special episode of Apollo 24/7's Health Hour, where we are going to be joined by an orthopedic surgeon who has more than 35 years of experience and a Padma Shri awardee, Dr. Yash Gulati. So hop in the live session and you can ask all your questions and queries about orthopedic issues. We are going to discuss about common bone and joint issues, what are the treatment options, how do you prevent them, and more. So ask all your questions in the live session. See you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and a very, very happy new year to all our viewers. I wish you all find health and happiness this new year. And we shall start today's episode with orthopedic issues. Our musculoskeletal health is very important to keep us fit and healthy. So we are bringing you one of the most awaited expert on Apollo 24/7's Health Hour, Dr. Yash Gulati, who is a senior joint replacement and spine surgeon at Apollo Hospitals, New Delhi. He's going to join us very shortly. Stay with us on this show where you can ask all your questions and queries about orthopedic issues. It can be spine, back, joint, fractures, anything that you want to talk and discuss these. Please do type in your question in the chat box. We shall take these questions up in a short while when doctor joins us. Also on the show, you can win prizes because we have a health quiz. I'm going to ask you 3 questions and you can win prizes from Apollo 24/7 as well. Please be with us till the end of the show where we give away gift coupons and also announce certain offers. Please be with us till the end of the show. So let's start this show today by talking about a wonderful initiative by Apollo 24/7 and Apollo Foundation, which is Saving the Child's Health Initiative, which is free pediatric consults for every child in need. If you know somebody who requires pediatric specialty, Apollo 24/7 is on a mission to make quality healthcare accessible to underprivileged children at no cost, with more than 10 plus pediatric specialties, bringing renowned Apollo pediatricians, which benefits children across India. There's a QR code on the screen you can scan and find more details, or there's a link in the description box as well. You can download or you can find more of this wonderful cause. Chalo, let's begin this new year with orthopedic fitness. So let me introduce our expert for today. We have Dr. Yash Gulati, who is a Padma Shri awardee, a senior joint replacement and spine surgeon from Apollo Hospitals, New Delhi, who has more than 35 years of experience in the field of orthopedics. He's done large series of total knee replacement with ISS navigation technique, and he is performing large number of partial or half knee replacement in selected cases. He has conducted the largest series of total knee replacement for sickle cell diseases in India and has treated the youngest patient for total hip replacement. He's operated on former prime ministers and presidents of India. He's treated Indian and international cricketers and other celebrities as well. He is a Padma Shri National Award conferred by, he has received a Padma Shri, which is a national award conferred by President of India in 2009. Dr. B.C. Roy National Medical Award conferred by President of India in 2016. He is appointed honorary surgeon to President of India in 2016, appointed honorary consultant Indian Armed Forces in 2002, and he's also appointed honorary consultant Border Security Force in 1998. It's a privilege, honor to welcome Dr. Yash Gulati once again onto the show. Namaste, Doctor, and welcome. Happy New Year to you.
Happy New Year to everybody and wishing a very good health to everybody and hopefully a COVID free year. Let this Omicron go and let's live in peace and good health.
डॉक्टर आप आते हैं ना इतना पॉजिटिविटी एंड शेयर स्प्रेड करते हैं आई फील दैट यू आर द पॉजिटिव हार्बिंगर फॉर दिस ईयर एंड विद ऑल दैट पॉजिटिविटी लेट मी आल्सो टेल यू दैट you bring so much of content, happiness by answering questions. You know, it's sometimes there's a very small question which lingers even before you actually meet a doctor or a physician. Your answer gives an hope which brings lightness to heart. Thank you so much for being that good messenger.
Thank you very much. I mean, it's very kind of you to say those words.
थैंक यू डॉक्टर. तो चलिए फिटनेस के बारे में बात करते हैं. आप तो हमेशा फिटनेस के बारे में बोलते हैं कि फिट रहो, यहाँ फिट रहो, यहाँ फिट रहो, और मस्कुलर स्केलेटल फिटनेस भी इम्पोर्टेंट है. So this year we want all our viewers, all Indians to be very fit. So how important is our bone health for our fitness?
See, when you make a house, you have to have a foundation and you have to have a skeletal frame. And that's what you build your house on. If your frame is weak, if your pillars are weak, if your foundation is weak, the house is going to crumble. So I think that answers your question. You need to have a strong framework of bones and muscles for rest of the body to function well. So it's very important to make absolute conscious effort to ensure that the bone health and muscle health remains in a good zone, because these are not like your steel frames which make the house. These are dynamic structures. There is a constant turnover of calcium and protein in the bones and in the muscles. So this is in our hands most of the times to keep them stronger, because it is these are dynamic structures. They are not static structures.
Right. So, what are the causes that may weaken the bones, and why do these bones break? It's not just the elderly who experience this. It might also be the younger generation who face weak bones and issues from them. What are the causes which cause weakness?
See, apart from people like Munna Bhai breaking 256 bones out of revenge, that is, or the accidents, the other reasons why bones can break on their own is when they become weaker. Of course, there can be some diseases. We'll not talk about things, those diseases, because those are different things altogether. But what can happen, what can weaken the bone in a normal looking person is when you get osteoporosis or when you get vitamin D deficiency. To understand why this happens is, let us understand what the bones are made of. Bone, if we look at under the microscope, it will look like a mesh which is made of protein. And on this mesh, there is this salt or calcium deposited, and vitamin D is the one which brings this salt to the bone. So
Okay.
anything going wrong with this cycle can weaken the bone. So if the mesh is weaker because say advancing age, or if somebody has been bedridden for a long time, or if somebody has been taking steroids or some anti-epileptics, so many other causes, this mesh can weaken. Or if somebody is deficient in vitamin D, the calcium will not come to the bone. Both the things can sometimes combine and the bone can become weaker. Similarly, muscles. The more we work with muscle, the stronger they become. You've seen the body lifters or bodybuilders or athletes, their muscles are much stronger as
Stronger.
you see. Those who are bedridden, the muscles waste away. That just shows that if you are making the work, they become stronger. This is true both of bone and muscles. So activity is the buzzword for keeping them strong. And vitamin D, many people are deficient in our country, so supplementation doesn't harm. But activity is the most important thing. And after a particular age, say in women, maybe around after menopause or around 50, one should check one's bone density. Similarly, for elderly 55, 60, check the bone density. If it is deficient, there are many drugs available now which are very safe and can keep the bone strong because these bone break when they become weaker.
राइट डॉक्टर, तो आप बोन डेंसिटी टेस्ट के बारे में जो मेंशन कर रहे थे, who has to get this bone density test? Only after certain age, or only women after menopause, or anybody at certain age should be getting their bone density?
Yeah, no, not anybody, because I don't think young people need to do it. Some ladies after menopause, maybe around, not even immediately after menopause, maybe 45, 50, they should get it done once. And sometimes people get paranoid. If it becomes a little deficient, they keep repeating it every 6 months or a year. It's not required. It doesn't help. So don't get paranoid about it. And sometimes even after taking drugs, the values don't change so rapidly on bone density. Don't get paranoid about that also. The idea of giving treatment for this is to decrease the fracture risk, which sometimes
Right.
is not reflected in the figures. So it's important to diagnose it, take the treatment, and keep active. That is the most important thing. Activity itself will make the bone stronger.
So keep working, keep making yourself very active. That will make yourself fitter. So next question is around about, while I was reading your introduction, I was introducing you. I've read something interesting, that is you are working a lot on partial knee replacements. What is this partial knee replacement? We've heard so much about total knee replacement, and who benefits out of this partial?
Yeah, see, the thing is that again, wear and tear of the joint is a phenomena which will happen in everybody to a lesser extent in some, to a bigger extent in others. Why it is less and more in some people, we still don't know. Maybe there is some genetic element or whatever. And then there are diseases like rheumatoid arthritis. That's a different ballgame. Now, most of the joint pains can be treated non-operatively by weight reduction, by simple analgesics, say like paracetamol, and again making the muscles strong around the joint. Because I often say that if the pillars are strong, even if the wall is weak, the house will stay. So make your muscles strong by building the muscles. But there a stage comes when these measures are not sufficient. And if the joint gets beyond a point, like if a road is broken beyond a point, you have to make a new layer on that. That happens every day, we see that. So if that stage has come, say in knee, then we have to do what is known as a knee replacement. But in Indian population, in Asian population, and many in Western population, about 30% of patients who are offered total knee replacement, actually the damage is only in one part of the knee. See, knee is basically three main parts: inner part, outer part, and behind the kneecap. So, in Asian population and many others, only the inner part gets damaged. So, there is no need to change whole of the knee in this. So, what I would say with responsibility today is that 30% of patients getting total knee replacement done in the world today actually don't need total knee. They need only change of that partial part of the knee. And that's what we are doing. There are some criteria to be met. We have to do proper x-rays. We have to do some stress x-rays. We have to see some other criteria. And about 30% of these patients who would be offered total knee would fit into this category of getting half or partial knee. It's a very small operation compared to total knee, although not less expensive. It is more sophisticated operation, similar cost, but the activities are much better. You can jog, you can sit cross leg, you can do light sports, and your bone, rest of the bone is saved. So it's a wonderful surgery when it is suitable for some people. And I'm absolutely sold out to this idea of partial or half knee replacement in cases where it is required.
We trust in your experience, doctor, and the kind of research and the kind of experience you have in doing multiple surgeries. We understand that you come from a research and valid point. So, understanding that not everybody requires a total knee replacement. Is it the same with spine surgeries as well? There is so much of discussion going around spine surgery. Is it necessary at all? Who requires a spine surgery?
Look, I said nobody wants surgery of any kind. Let's be very clear about it. Nobody says, चलो चलो आज घूम के आते हैं या चलो आज सर्जरी करा के आते हैं. It happens
G.
only when somebody has a situation where there is no other answer. So
Okay.
surgery should, in my book, I do surgery for what is known as absolute indications, not for relative indications, as we read in the books. So when we offer surgery, the surgeon should be very sure in his mind, to the best of his ability and his experience and knowledge, that he is much more likely to benefit the patient than not. If that is the scenario, then only surgery should be offered. There are many situations where if the surgery is not done, a great damage can be done. There are many cases, like for example, in a disc prolapse, 90% patients will settle on their own. But if with a disc which is very large, which has come out of its place and is pressing all the nerves and has stopped our bladder or urine function or function of defecation, then that is an urgency. If the surgeon at that time does not impress upon the urgency and request the patient to get operated, he would be in negligence. Whereas in other routine cases of prolapsed disc, he would be negligent if he offered surgery in all the cases. So, patient choice is patient selection is extremely important. And I said 90% will settle down with this prolapse. Out of them, those 10% who do not settle down after 6 weeks or 3 months or have very severe pain, those are the ones who will need surgery for slip disc. Similarly, other causes of spine problem, or if somebody had a tumor in spine, you can't sit on it, you have to remove it. So it goes from case to case, and then you have to have a very good patient selection. I often say if we do surgery in patients who desperately need it, the results are wonderful. If surgery is done in patients who could well do with or without surgery, if you do surgery, results are not so good. Patients don't really appreciate the benefit. So the bigger the problem, the bigger the benefit. So that is my slogan. The bigger the problem, the bigger the benefit after surgery.
Well, I have bigger audience today for you, doctor. So as we are talking about these issues, I see our chat box bombarding with questions. So let me start taking questions one after one. I have a few preset questions, but I think we'll give audience a little more time today. My first question is from Mr. I'm sorry, yes. Abhishek, no. My father has knee pain and he's not able to sit or stand. आपने नहीं दिया है, but a lot of people are asking about arthritis and osteoporosis and knee pains. What is the common answer for all of these? Knee joint problems hai. Then I'm suffering from a right hand shoulder pain from last few days. So how does one
See,
understand
these
arthritis?
things are very different. Osteoporosis and osteoarthritis are two different things. A knee arthritis or osteoarthritis or osteoarthrosis is age-related wear and tear of joint, whereas osteoporosis is weakness of the bone, as we discussed earlier. These are two different things. So many
Yes.
times in the outpatient department, also people confuse ki is osteoporosis cause of my arthritis. Generally not. Although it can aggravate the pain, obviously, because of microfractures. So let's keep them separate for the moment. And as I said in the while answering my last question was that most patients of arthritis can benefit by strengthening the muscle, simple analgesics, and weight reduction in the lower limb joints and in upper limb also doing exercises, etc. Similarly, in shoulder wear and tear, physiotherapy is the most important thing. In selected cases where they do not improve or where the damage is too much, then surgery may be offered. For example, if in shoulder there is a tear of the muscle which move it inside what is known as rotator cuff, that may need a keyhole surgery. In knee joint, if there is a loose piece of bone which has come out, or a meniscus which is a cushion inside the knee, if that has got torn, then it may need a keyhole and arthroscopic surgery. Or if indeed the damage is extreme and if it is gone beyond a point, then the joint may need a joint replacement, which can be done for all major joints, including fingers. But
Done.
again, I would keep repeating again and again, the the patient should deserve the surgery. Patient should be requesting the surgery rather than surgeon forcing the surgery on a patient. Patient should be saying, look, I'm done. I cannot do without it. Please do something for me. That is the time to do surgery.
Done. So Mr. Prakash and Mr. Gaurav Jain, I think your questions are answered. Both of them are asking, is knee replacement only solution for elderly people? And Gaurav was asking, 62-year-old mother having bad knee and bad back who's a breast cancer survivor. I think this is the answer for both of them. It's up to the patient
Yeah, I
whenever
mean,
that's
it will depend on the extent of pain and disability and whether non-operative treatment has been tried and not worked. But in some cases, when you look at it and the damage is already too much, then one may say there is no point wasting time on non-operative treatment. But generally speaking, in the earlier stage of the disease, one would try non-operative treatment.
done. So next question is from Mahashweta and Shravani. Both of them are asking about hip joint and tailbone pain. What are the reasons and what can be the possible treatment?
Well, again, these two are very different things. Let's talk about the tailbone pain, which is not uncommon and often it does not resolve that quickly. Many times, thanks to our great roads in our country, at many places you get bumps, free rides, free bumps while we are traveling, and that causes damage to the tailbone, sometimes acute, sometimes over time. And that can cause pain when you sit on a hard surface or when you sit for a time and want to get up, it causes pain right at the tip of the tailbone. And this is what is known as a coccydynia. And sometimes you have a injury, you fall down, you might fracture this small bone, which is known as the tail of the spine. So in these cases, there are special type of cushions which are available, which take the load off the tailbone, and then one can sit in a warm water, warm it up, and sometimes an injection can be given. Very rarely surgery is required. But remember, this type of pain can also be caused by sometimes there is what is known as a pilonidal sinus or a small little fluid coming out from perirectal area or some little infection there. So these have to be ruled out, and then only we have to give the diagnosis of coccydynia or pain due to the pumps. So if it is due to other causes, then they have to be treated on merit. Now coming to the hip pain, again, hip is a big joint. It's like knee joint or other joints. This can undergo wear and tear with age related, or these days when people had a lot of steroids after COVID, many patients had what is known as an avascular necrosis or damage to the blood supply, and those cases have increased. So in those cases, in early stages, we may have to make small drill holes, or there are special drugs which are used in osteoporosis can also be used in this condition. But if the push comes to shove, when it becomes too bad, as I say, if the road is totally broken, we may have to make a new layer and change the hip joint. So these are again step by step treatment depending on the pain and disability.
Done. So next question I would want to take up with ACL tear. Amarnath Shetty he has had an ACL tear. He's asking if I can play again. And then next Himanshu Sharma, MRI there is grade 1 ACL tear and grade 2 signal in meniscus. Do you think surgery is the only option? It hurts all day long now. Please help. 28-year-old. And there is also another ACL I couldn't.
Okay, I'm very happy you have clubbed them together because a lot of questions will be answered. Look, what is ACL? Anterior cruciate ligament. There are two cross ligaments in the knee which join our leg bone to the thigh bone, and these get torn in twisting injury. For example, in a dashboard injury in an accident, or a playing soccer, or anything skiing, anything that causes twisting injury to the knee. Now, this ligament tear is often associated with some tear in the cushion in the knee or the meniscus. So if both are damaged, then obviously surgery is required. If only one is damaged, sometimes one can do a very good rehab and get away with it in non-athletic people, in sedentary people, or in people who are beyond the age of 45, 50. But in athletic people, people who want to play, or people who are younger, I would suggest that in these cases a keyhole surgery should be done to replace the torn ligament. This ligament itself does not heal. But please don't get confused with MRI reports. All MRI reports are compared to somebody who is 14 or 16-year-old. So some amount of change will be shown in MRI in a 30, 35, 40-year-old person. That does not mean anything. And again, grade 1 and 2 changes don't mean anything. It just means that, look, I had 1 million here and out of then about 10,000 are gray. It doesn't mean anything. Okay, but only if it is grade 3 or a complete tear, we need to address it in by whatever means. So don't get confused. If there is pain, do rehabilitation, physiotherapy, occasional analgesic, and strengthen your muscle. That's what I keep saying, because those strengthened muscle will take the load off the bone. But surgery is not required in grade 1 and 2. Please don't go get confused with these terms. Please don't get confused. A lot of people come reading on the net. Look, I have this and that, and they get all kind of diseases by reading on the net. It's okay to get informed, but please don't panic. Because if you have a doubt, go and talk to your local doctor and get your doubts cleared and live happily. Many people just get paranoid about it. Don't do that. I'm sorry, you're not audible.
Check. Am I audible now, doctor?
Yes, you're audible now.
Sorry for the technical difficulty. Soumya Atnoor's question, 32-year-old woman, severe pain in lower back. MRI says it's a disc bulge. So, what can be the treatment options?
You said 38, 38,
32. 32.
32. Okay. Young lady, these bulges again don't mean anything. Don't get confused. Again, it is being compared with somebody who's 16. They just don't mean nothing. So don't worry about it. This just shows that you are 32, not 16. That's it. Okay. And again, in these kind of cases, you just have to strengthen your back, take precautions regarding your back. Don't lift anything heavy. Don't bend forward to lift heavy weights. Have a good mattress when you're sleeping. Have, if you're working, your desk height, your chair height should be right for your height. Don't sit at one place for a very long time. Don't go for a very long drive at a stretch, and keep doing exercises, yoga, etc. You are normal person and you don't have any disease. Just strengthen your muscles. And if you are deficient in vitamin D, etc., just supplement yourself. You don't need to visit any doctor unless the pain is continuous, disturbing you at night, or if it is very severe.
This
Otherwise,
is what,
this is just.
yeah, this is what makes you different and puts you on a higher pedestal, doctor. Thank you so much for being what you are and what you promote. Because you don't sell surgeries, you say, please get fit. And that's what makes you very special for us. Thank you so much.
Yeah, I mean, see, I again say, nobody wants surgery. So why should I not be on my patient side? Why should be on the other side? If somebody wants it, he'll come to me. I mean, nobody wants surgery. That's a fact of life. So
Right.
that's fine. One has to recognize it.
Okay. Next question is Chaitali Datta, 49-year-old having ankylosing spondylitis since 15 years and also had a fracture in my hip joint. I've visited numerous doctors across the country, but nothing worked. Still having pain. What's to be done?
See, unfortunately, ankylosing spondylitis starts at early age and then it burns out around 35, 40, but it leaves behind its marks. Sometimes stiff back, sometimes stiff hips, sometimes a person is bent forward, but there is help available. I don't know what kind of fracture she had around the hip. That's not very common in ankylosing spondylitis. That may be a coincidence.
Or
But if there
something.
was a fracture, it should have been addressed on merit. In a young person, we would want to fix it. But mind you, in some very young people whose hips are fused because of ankylosing spondylitis, and the spine is also fused. Sometimes in very young people also we have replaced the hip. Although normally we reserve replacement for elderly people, relatively elderly people. Now the definition is changing. And but the fracture around the hip, I would want to know the details of the fracture. Please go and visit your local orthopedic surgeon. Fracture would be treated with fixation if it is displaced, or non-operatively if it is not displaced. So it will be treated on merit.
Done. Next question we would want to take up is Chanchal Agarwal. What are the precautions and that must be taken after ACL avulsion surgery? I'm not sure what this is, doctor. You must be knowing better.
Well, it's the same thing we discussed, ACL avulsion or ACL tear. You see, you need to have a great rehabilitation after ACL reconstruction surgery. Strengthen your hamstrings and quadriceps. Your doctor will give you a regimen of treatment. Initially protected weight bearing walking, after 6 weeks, normally in my practice, full weight bearing, then light jogs around 10 weeks, then maybe running around 3 or 4 months, and contact sports after 10 months. So these are the precautions we need to take, and obviously a universal precaution is if one is not overweight, it helps in almost everything.
Okay. Thank you so much. That was a younger person's question. Now I come to a senior's question. Sriram Ganpati, who is 82-year-old, he's thanking you for the session, and he says, when I get up in the morning, there is a backache for about 1 hour. Then the pain stops once I'm moving about. Is this caused by the type of bed I'm using, or is this anything other to do?
It
Anything
can
else?
be because it is usually because of aging or wear and tear. This is the first sign of wear and tear. If if it happens, for example, in hip or knee wear and tear, if you sit and then it becomes stiff, if you walk, start walking as though somebody has oiled it and it gets better. And in the back also, we have lots of joints which are of the same type, their hip and knee, same structure, similar but smaller. So they also go through the same process. And this is a sign of wear and tear of the joint. And stiffness is the first sign. But of course, bad mattress does not help. Bad postures do not help. So if there is a problem going on, we should not. There should not be a double whammy. On one hand, there is a problem of wear and tear, and the other hand, we are giving bad postures and not doing exercises, not strengthening muscles. So those things are in our hands. We should mobilize the spine. We should do yoga. We should walk as much as possible, strengthen the muscles, and supplement our vitamins if we are deficient. And in the morning, do a bit of exercises. Even when you're getting out of the bed, just mobilize yourself a little bit. And this is the sign of a wear and tear, a sign of healthy aging, I would say. Is not bad. And this can be easily taken care.
Wonderful. That's a positive reiteration again. Next question is Arpita Majumdar, who's 45-year-old female, OAs, osteoarthritis stage 3, bone density is fine. Please suggest how I can manage.
Well, we discussed this before. Um, if one is overweight, try and lose weight, strengthen the muscles. If it is an early stage problem, there are some drugs available to enhance the joint cartilage. I do not know how good or bad they are. They usually do not cause bad effects, but how good they are, I don't know. But they are in practice and may be worth trying for a few months. Some people keep taking those glucosamine for years and years. It's not required. It's a waste of money. So just take it for early stage and for a limited period. And of course, as I keep repeating, activity and muscle strength, these are important, and weight reduction. I think this should help, and as simple a painkiller as possible, say paracetamol, things like this, or other one if required.
While you were talking about these joint supplements and all, there was a question while I flipped, asking about natural chondroitins and natural supplements. Are there any foods or any supplements that are
Well,
available to improve?
there are anecdotal things one hears about taking haldi and milk haldi, which I mean I'm turmeric is, I'm sure that it has a medicinal value. listening to all the reports and talking to people, even from personal experiences, some people. So I would say that haldi is not a bad idea to take. And if there are other some natural products, I'm quite game. I think it's the medicine has to be holistic, not one particular branch. One should not have a tunnel vision. If some other branch gives benefit, so take benefit out of that. But please ensure that those medicines do not contain harmful products like steroids and things. So that is important to be sure of what one is taking. Because in homeopathy also, I've seen people's warts disappearing after some doses of homeopathic medicine. And I have seen acupuncture working in some cases and some Ayurvedic medicine working in some situations. But one has to be sure of which thing will work where. So
Correct.
we cannot be like some these babas claiming on the TV that I have cured cancers and all. That may not be true. So one has to be very judicious about going into holistic medicine.
Done. Next question is Shaswat's. He cannot bend knee after certain points, 80, 100 degrees. Beyond that, he is not able to bend. So, can you suggest what can be done?
Well, I presume the gentleman would be above 50. It is probably the reason is wear and tear or arthritis, which may be age related or rheumatoid or whatever. Sometimes this can also happen due to an old injury to the joint. If this is the only disability, physiotherapy is the answer because beyond 120 you don't really need in most of the activities. But if it is associated with pain, then the treatment has to be different. Then one has to do x-rays and decide what one needs to do.
Done. As we were talking about supplements and medications, there is a question about vitamin D, Bio D3 plus, and Avion, which has been prescribed for more than 1 year. How long one should continue? It's about a 67-year-old female. And also, if sunlight gives us vitamin D, how long and what time should the sunlight be? Should one be sitting in sunlight?
See, sunlight gives does not give vitamin D. Sunlight gives you ultraviolet radiation, which helps body to manufacture vitamin D. So one has to be exposed to sunlight for 45 minutes a day, naked, whole body, and that will be sufficient to manufacture the required amount of vitamin D. And especially in colored races, in blacks or even browns like us, the exposure has to be even longer. So, which may not be practical in this day and age. So one has to be careful. If somebody is deficient, there is no harm. The harm taking vitamin D supplementation is totally harmless when taken orally. But one has to be careful when somebody is suggested injectable vitamin D because that, if it accumulates, can cause toxicity. So, unless somebody has some gastrointestinal absorption problems, the oral vitamin D works as well as injection. So, there is no need for injection in most of the cases. But some supplementation may be required and there is no harm taking.
Done. So, glucosamine, chondroitin, all these are also the same
Well,
category.
as I said earlier, I do not know. Sometimes these are pharma driven, sometimes these are, we don't know. I mean, I'll be able, I cannot answer your question with certainty that they definitely help or they definitely do not help. Now, there are so many reports, sometimes they are pushed by pharma companies that they say if you keep telling a lie repeatedly, one starts believing them. So I don't know whether these are pure lies or they are half truths or pure truths. So that is my honest answer.
Urmila ji and Uni RT, I think your question is answered there. Both of them were asking about these supplements. So that question is answered. Next question is about is from Mr. Subbareddy. Sir, I had a laminate surgery 6 years earlier. My body is still getting stiff and hands are numbness. What are the reasons?
I'm sorry, I didn't understand which surgery.
It says laminectomy surgery.
Laminectomy is a decompression of the spine. It
Okay.
might have been done for narrowing of the spinal canal or what is known as a spinal canal stenosis. Or sometimes some people do it even for disc. Although not required these days, we can do a microsurgery for disc. So if you still get pain or numbness, it may be that some other level also is getting affected, a level above or below, or the damage to the nerves has been so much for so long that some residual effect is still remaining. There are drugs available for that. There are exercises, strengthening muscles available. If the pain is significant, then a repeat MRI scan to see whether another level is also involved may be in order.
Done. Here's a question post-COVID steroids involvement. Bharadwaj Gandavarapu. My wife has AVN stage 4 in the right hip and she's 27-year-old. And this occurred due to COVID steroids. Is hip replacement surgery needed in this case?
Well, unfortunately, as we mentioned earlier in the program, steroids given beyond a particular point, which may be life saving in certain situations, which I am sure was in her case, have this side effect. They can cause avascular necrosis or crumbling of the head of the femur or the ball of the hip bone. If and as he said, grade 4, which means that there is already some irregularity on the femoral ball. If it is too much, if the pain is too much, and if there is arthritis already set in, then age is not a criteria in these situations. So one has to be very, very careful at this age in suggesting replacement surgery. It will depend on the amount of pain, the disability, the X-ray picture, everything will have to be taken into consideration for giving this decision. So please visit your local surgeon and decide whether it is required. But if see, you can't live in pain. It's as simple as that. If the pain is significant, then we have to do something. I mean, you can't say, okay, I live in pain for next 30 years, and when I'm 57 or 60, I'll get a replacement, and all my productive life is gone in pain. So that answer is not correct. So we will depend on the. I will. Deliberately repeating this answer because it is such an important decision to be made in a young person that we have to be very careful, discuss in detail, and you also think in your mind whether your pain is sufficient for you to go for surgery, and most definitely you'll need repeated one or two more surgeries in your lifetime. So everything has to be taken into consideration. But
Done.
it is not a contraindication.
Shwet Kumar is just 22-year-old. My bone mass is too less and whole body mass is also less, very skinny. What can I do and what are the risks that he is facing?
Well, you see, there are some things which are genetic. There are some people who can keep eating as much as they want and they don't put on weight, and people like me, if I breathe too much, I put on weight. So I don't know, we don't understand these some of the factors, we don't. But generally speaking, a good diet would be very important to build your body mass and your muscles, and of course, as I said earlier, exercises will also build your muscle. It's not important to look fat or bigger. Sometimes thinner people may be much more stronger. Most of the athletes you've seen in the world are not, they look thin. That doesn't matter. Sometimes in young people they get this complex, oh, I'm very thin, and this. And some people get a complex, I'm fat. Don't go by this body figure, the body image. What you need is the inner strength. And if indeed you are weaker than the average, then maybe an endocrinologist should be consulted to see if there is any endocrine problem going on, any hyperthyroidism or any hypogonadism. So these things can be then checked whether there is some treatable cause for that. Otherwise, good supplementation, good nutrition, good exercises would be the answer.
Right. Mohammed Imran is asking, my hands and legs are getting numb frequently following by pain. I'm not able to do any work and not able to eat well also. Is there any underlying orthopedic issue to this?
Well, I mean, this numbness, etc., in all the four limbs can be because of some what is known as a peripheral neuropathy or some nerve problem. Sometimes maybe because of diabetes, sometimes without it, or sometimes it may be because of some cervical spine problem in which the cervical cord is getting pressed. So it needs, and vitamin deficiencies can also cause this. So one has to be a little careful in finding out the cause of this and then treat it accordingly.
Yeah. Abbas Naqvi ji पूछते हैं, sir, I've recovered from COVID in May 21 and from then I'm continuously feeling pain in both legs, especially below the knee. Has some COVID something to do with this?
Well, we have noticed that after COVID, many people have had joint pains, many people have had some muscle pains for a few months. That is true of many other viral illnesses also. So, if that is the case, maybe good supplementation, again, vitamin supplementation and exercises should take care of it. But at the same time, also, if you have taken steroids, make sure that you have not developed osteoporosis, things like that. And if that is not the case, and if pain does not settle, then maybe you should see a local orthopedic surgeon to find out if something else is developing. But in 3 to 4 months, or sometimes it has taken 6 months, people to recover fully. If it is mild, then it's okay, and just do supplementation and exercise.
In continuation with the same COVID recovery, DK Bagotra faces stiffness in finger joints after COVID, but my RA factor is normal. Is it the same thing, doctor, that you've answered earlier?
Well, yeah, something like that. But mind you, uh, problems like rheumatoid arthritis, they generally start around 25, 30, 35. Sometimes elderly onset later on in 60s also, and they generally starts with pain and stiffness, morning stiffness, which stays for 3, 4, 5 hours in the morning, and or swelling in the small joints of hand or feet. But mind you, in these cases, rheumatoid factor and other blood tests may be negative for 6 months to a year. So, clinical diagnosis is very important to start what is known as disease modifying drug. But listening to his problem, I don't think it sounds like rheumatoid. So, it may be something different, and maybe exercises may be the answer. But see a doctor locally and see whether indeed it is only a trivial post COVID thing, or is developing things like rheumatoid.
Okay. Gauri's question is, sir, I'm 25. I got knee pain and doctor told cartilage gap and suggested knee exercises. But pain is always continuing. I'm 38. Gone MRI, I found meniscus tear and cartilage damage in both knees. I hope you got the question. Question
Yeah,
is in
okay, I
good.
got it. This is a very common scenario. See, meniscus damage depends how much. Is it torn enough and causing pain in that particular area? Then it needs a keyhole surgery. Some amount of cartilage damage, which is wear and tear, many growing children have it, and then it settles after a few years. Some adults also have it, but unfortunately, as I said, in those cases, if there is no other reason, then it has to be a symptomatic treatment only. So, surgery only if the meniscus is causing mechanical problem or pain in the torn meniscus area. So, we have to correlate, and the meniscus tear is complete. It's not grade 1 and 2. Grade 1 and 2 do not mean anything. It just shows that there is some little abnormality in the meniscus. Its signal is different than the 16-year-old person's meniscus.
Right. As we're talking about age, we are talking. Srividya Nayar's daughter is 14-year-old, but she has pain in the lower part of both legs while she is running. Is this a factor to be
Yeah, these are not
considered?
uncommon, not uncommon. Sometimes these are shin splints. Sometimes they are, because of the bad footwear or some flat-footed people. So you need to see a local doctor to see if you have flat foot. Is your shoe wear all right? If your shoe is good, well cushioned or not? Is your tendo Achilles and hamstring muscle not tight? So does it need stretching? So these kind of things can help in these cases. And of course, whether there is somebody who's vitamin deficient, vitamin D deficient, and in some people, long-term running and long walking marathon can actually cause a stress fracture in lower part of that leg bone. So that also has to be ruled out. Now, one will see the patient, listen to the patient, do the investigation accordingly, and decide whether it is only a shin splint or some deficiency, or indeed somebody is developing a stress fracture. So accordingly, the treatment will be there.
Yeah. Urmila is 60 plus, and what can be the preliminary investigations beyond regular X-rays that can help predict the state of knee health in old age? Can blood test help predict osteoporosis?
Not really. Blood test can tell you about your vitamin status, vitamin D, osteoporosis. You need to do bone density. You don't need a sophisticated test like MRI and all that unless there is a definite reason to do it. I mean, in my practice, I do MRI mostly if I'm not sure of a diagnosis or if I want to make a diagnosis where I think surgery is required. Otherwise, MRI is a relatively expensive test. There is no point wasting money. but where it is required, it must be done.
Done. So next
I mean, I've seen
question.
patients coming, let me just say it here. I've seen patients coming with bundle full of MRI. Some people come, can you do MRI on my whole body? And then even before doing X-ray, people do MRI. And they come and, put those MRIs on the table. Look, have I got some problem? And I say, have you done your X-ray? They say, no, why you need X-ray? Because I've got the MRI. So I want to tell this to people that X-ray and MRI are two different things. MRI is to see soft structures inside and only specific things. And this should not be misused. For example, in developed countries, in Western countries where healthcare is, you don't have private centers running so much like in our country. To get an MRI is a big deal. It is done only when it is absolutely required. Here, we just go and it is again pushed by people to do MRI because it's commercial at the end of the day. So one has to be careful and see every investigation should be used and not misused or not overused. Where it is
Overused.
required is very important, but don't overuse. Sometimes you'll do MRI and you'll read reports like grade 2 changes and edema in the ACL and wear and tear, some chondromalacia, and then people get really worried. And there's no need to do that. So first you do an X-ray. If there is a reason, then only an MRI will be done. As I said, if really, you see, if one orders an investigation, the doctor must think in his mind, is this going to help me in making a diagnosis which I can't make now? Or is this going to help me in planning my surgery? If the answer to these two questions is yes, only then do investigation. If the answer is no, then don't do it because don't waste time and money. We seem to have some connection problem with Jhansi, so somebody can maybe address it.
Doc, we have a question from a viewer. He asked that does does this cause any issue to does this issue cause any issue to bone density and breakages in future? She is 26 years of old and she has swelling of feet post COVID.
Which issue?
So
Not
she
really.
had
I don't think it'll have any long-term effects. No, not really. No, not unless somebody had taken steroid and developed avascular necrosis of hip bone mostly, or sometime even in the bone around knee. But otherwise, I don't think they should have permanent problem. I don't think so.
Extremely sorry due to technical reasons. I think I dropped out of the show, but thank you so much for continuing and taking up the questions, Doctor.
Sure.
Yes. Doctor, I think we're almost towards the end of the show, and we've addressed most of the questions. I thank you so much for being with us on this Sunday morning. And as we are all facing one common था जो threat हम लोग face करते हैं नया लॉकडाउन का भी threats looming over. If I remember last time I met you while in the lockdown, you were very seriously practicing one of your hobby, that is a saxophone. And how's your
That is
progress
correct.
with?
Well, I'm still at it. I mean, I do it every morning and evening. Even if I reach home at midnight, I do practice even after that. So, and it keeps me sane. So I'm doing that. So I'm happy to
Wonderful.
do it.
So stress busting activities and having a good hobby in your life. And I may now request you to play something for us in the new year.
Okay, let's try. Let me just try and see if I can. No, it'll take me. Yeah, okay.
अगर मैं सॉन्ग रिक्वेस्ट भी करूँ ना डॉक्टर, तो मैं हम लोग तो कोविड की वजह से ना आगे जा सकते हैं ना पीछे जा सकते हैं, तो मैं रिक्वेस्ट करूंगी आगे आगे भी ना जाऊं.
ओके चलो वही वही करते हैं आगे भी जाने बिकॉज एक्चुअली दिस इज ट्रू इन टुडे सिनेरियो कि आगे भी जाने ना तू पीछे भी जाने ना तू जो भी है बस यही एक पल है. So I'll just play a small portion of this because I'm sure because of
Wonderful.
time's constraint.
Done.
Full song some other time.
Definitely, Doctor. Wonderful. Thank you so much for playing this and taking this effort of bringing your saxophone for us. Thank you so much. So, I
You're
would like to
welcome.
take
Yeah.
leave. Before that, I would want you to give us top tips. What are the top tips to keep our orthopedic fitness up?
Well, the topmost tip is keep walking. So that means keep doing exercises, stay active, activity, activity, activity. That is the mantra. If one can do that, all other things will fall into place. One has to do walking, exercises, yoga, or in summer, swimming if the conditions permit. Then, of course, one has to watch one's weight, diet, do good supplementation of vitamins and correct amount of carbohydrates, proteins, and fat. You can talk to a local nutritionist and take advice on that. And be careful if there is any deficiency of vitamin, it should be taken care of. And in a particular age, after a particular age, one should check one's bone density. And if there is osteoporosis or low bone density setting in, treatment is available, should be taken. And elderly people should try and prevent falls at home by being careful in the house furniture. There should be no cluttering. The floor should be non-slippery. The mats in the bathroom should be non-slippery. There should be railing in the mats. The shoe wear should be good. If walking aid is required, should be used. Good visibility, good illumination, and if somebody has a visibility problem, cataract surgery if required, glasses if required. So it's very, very important to prevent falls for the elderly, to prevent sometimes life-threatening fractures. Even hip fracture can be life-threatening. So if the falls are prevented, we can prevent those fractures. So keep walking, stay active, do exercises, prevent falls, and look after your diet. Take care and have a healthy year ahead. Thank you.
Fantastic, Doctor. Fantastic. And I see your fan base responding to you. Lovely comments. And thank you so much, all of you, for wishing Doctor. And also, Doctor, your music is also stress buster for audience. That's what people are commenting. Thank you so much.
Next time, full song.
बहुत अच्छा लगता है whenever you are here on the show. You bring so much, you radiate joy and positivity. And thank you so much for being with us once again on this new year. Thank you, Doctor.
Thank you, Jansi. It was a pleasure talking with you. Thank you. And good luck to everybody.
Yes, thank you so much. So let's begin the year's health quiz. I have three questions for you all, and you can win prizes from Apollo 247 as well. You can answer the questions as I say. I'm going to read the questions out for you now. The questions are also being displayed on the screen in a while. You can type your answers in the chat box. The winner's name will be announced towards the end of the show, and the winners will be selected in the sole discretion of Apollo 247. You have to write back to us to claim your prize. The first question for today is, which option on Apollo 247 app enables you to upload your health records and access them anytime, anywhere? I repeat the question one. Which option on the Apollo 247 app enables you to upload your health records and access them anytime, anywhere? Question number two. Which is the longest bone in the human body? Question number two. Which is the longest bone in the human body? And question number three. When is the World Arthritis Day celebrated or observed? Question number three. When is the World Arthritis Day celebrated or observed? These are the questions. You have to answer them in the chat box. No hurry. You can take your time. Research karke bhej dijiye. I'm going to announce the winners in a while. Winners are going to be selected by Apollo 247 team. And in the meanwhile, while we select the winners and we announce the winners, please do go ahead and use this code FIRST3 on Apollo 247. When you buy your first 3 online medicine orders above rupees 1000, you avail 25% off on Apollo 247. So go ahead, use this code. It's called the first 3. And actually, once you have Apollo 247, you have a lot of benefits. I myself, I'm an Apollo 247 user and I'm a Circle member too. So I get a lot of benefits by becoming a Circle member. If you are a Circle member, join Circle right now and get flat 25% off on the first 6 online medicine orders. You heard me right? If you become a Circle member today, you get 25% off flat on the first 6 online medicine orders, which are above rupees 1000. You can use this code CIRCLE6. It's absolutely a free delivery. Online पे medicines order कर सकते हैं, but then delivery charges काफी होते हैं. So Circle membership बन जाइए, hassle free delivery होता है. So use CIRCLE6 and get flat 25% off on your first 6 online medicine orders. Thank you so much, all of you. It has been a wonderful session with your questions. And here are our winners for Health Quiz today. It's Sukhdeep Kaur, Lavanya Chellapilla, and Anvesh OP Vlogs. Congratulations. Please write back to us at marketing@apollo247.com with all your details and claim your prizes. Thank you, all of you. Here are the coupon codes which we give out. HH247 is the coupon code that you can use. 199 rupees off on consultations and up to 20% off on your medicine orders. So it was a wonderful having you all on this show. Please use this code HH247 on Apollo 247 and 199 off, as I mentioned, and 20% off on medicine orders too. It was a great orthopedic fitness session with Dr. Yash Gulati. Thank you so much. And next week, it's going to be Omicron and vaccine. See, vaccinations are available for children about 15-year-old from today, and also we are talking about booster vaccination doses. So what are the queries that you have about Omicron and the vaccination? All that you need to know with an expert from Apollo Hospitals. Do tune into next week's Health Hour, which is going to be very valid and very informative. That is next Sunday, 9th of January, 11 a.m. Be sure to be there. You can also register before. That's it for this week. Next week, we shall be back. That was an interesting episode. Thank you again for joining us. Namaskar. Please stay safe.